Hello everybody, my name is Hassan Dumbuya. Today we are going to talk about Nebosh Safety course, and in this course we are going to talk about element 1. Element 1 in the topic there is called Foundation in Health and Safety. We are going to talk about the foundations. First, we're talking about the scopes, nature of occupational health and safety, right? Multiple discipline and nature of health and safety, right? Health and safety involves removing, maximizing then the cause of accident and other events in a working place which may have adverse effect on worker. This simply means that in every safety areas, this course try to help to minimize the risks of accidents, the risks of fraud, the risks of any incident that will occur. So it try to reduce it or eradicate it or reducing it. So these are what safety is talking about. It means investigating a range of issues. How we can investigate a range of issues like chemical, biological and physical. If we're talking about chemical, right? Chemical safety, you have to know how you can deal with contamination, and some chemical like cleaning chemical, your food or biological chemical, how you can distinguish them or segregate them from other cooking items or other items that can become toxicity, right? Then we're talking about understanding why human beings behave the way they do, right? Sometimes because of human being behave with their attitude problem can lead to highly risks, and that risks can also endanger our safety, right? So I'm going to talk about the barrier to health and safety. What are the barrier? When we're talking about barrier, these are the things that can stop safety, right? That can make safety not to progress, right? So we're talking then also things that can affect health, right? When we are talking about the barrier to health and safety, although risks to health and safety are now better monitored, it is not always easy to identify the relationship between the cause and the effect because of this barrier. What are the barrier? The barrier are range and complexity of practical and behavior issues to be considered. So this simply means that in every facility or every community, because of the attitude or the behavior of some certain people, the negligence of some certain people, right? So this can also endanger the society, right? It can bring risks. So these are the risks. The attitude of a people can endanger another people. So it's a barrier to safety, right? Because sometimes people don't follow the rules and regulation, people are negligent, right? So these are barrier number 1. Then barrier number 2 is competing and conflicts demand placed on management and worker. This simply means that there are certain times competition arises between one worker and the other, right? And conflicts might occur. When conflicts might occur, any person that highlights or see a risk that can lead to the explosion of an order, right, cannot identify that risk because it's not that he wants his fellow colleague to fall into that certain risk, right? So these are barrier because of competition also and conflict. It can lead to these are barrier to health and safety, right? Then we are going to talk about the definition of health and safety, where in that definition we are going to talk about health, safety and welfare. So these three organs are come together: health, safety and welfare, right? In the definition, health and safety at work cover a wide range of concepts What are the concepts? One is health. Health refers to the physical and mental condition of people at that working place. The employee or contractors or laborers or visitor, right? And their protection from harm in the form of injury and disease. So this simply means that in the health, people should have the good mental mind. They should be in a good proper state of mind, right? So when they be in a good proper state of mind, it cannot affect or it cannot endanger the life of people that are in that surrounding, right? That simply means that, let's say if there is a corona or Ebola, if one person is contaminated or gets infected by that one, they cannot able to remove that person at that particular moment. It can infect the other, right? Then also someone have an injury, right? There is a burn, there is a fire going on, someone is being hot or get an injury. If they cannot able to eradicate that fire at that particular moment, it can injure another person. So right, but we are talking about disease, right? So when one way, like someone have a flu in a workplace or in a community or in your home, right, you don't try to isolate or get treatment for this person. It can affect the other person or the other staffs, right? Then we're talking about safety. Number two, safety. Safety refers to the condition at the workplace and apply to the pursuit of a state wherein the risk of harm has been eliminated and reduced to a acceptable level. So safety in this context means that wherever safety precautions in every facility or every community, there should be a safety precautions, right? So when the safety precautions are put into considerations, like how where people should walk, the pedestrian people should walk, and where vehicles should drive on. So these are control measures. So it has totally reduced the risks, right? So safety means that either it can reduce the risks or eradicate the risks, right? So in every area where there is a safety, it can minimize the risks, right? So people will not fall victim of accidents. Even though they fall victim of any incident or accident, it will be minimized, right? It will be in a low tune, right? So let's say, like for example, every fire precaution in every buildings or every safety roads, right? They have the safety, the rules and the regulation that is governing driving. So this one is minimizing the accidents. Let's say in a bus park, a bus stop, they have a limit that a driver is supposed to drive. So they put a law that the driver should drive above 60 kilometer or below 60 kilometer or from 60 kilometer to 80 kilometer. So the limited is speed. So that one we give caution to the driver, and it can minimize accident. And there is a rules of safety say that driver, they should check all their vehicles whether it's in good condition, whether the horns are working, the tires are smooth. So all these are safety, they are under safety, right? Then we're talking about welfare. Welfare in the third place, welfare refers to the general well-being of people, primary employees at a workplace, and the promotion of condition which help to provide for their needs in respect of health, comfort, and social and personal being. So welfare simply means that in every workplace, an employer will provide a very good place where the staffs can be working or the civil servants can be working there. And this civil servant, they should have a good facility, right? Where in this facility, the place should not be hot. It depends, right? So these people also will have, because of the good environment, will able to maintain their good health, right? Then they will not be prone to any accident, right? So this is welfare. Then I'm going to talk about moral, social, and economical reason for health and safety. When we're talking about moral, Moral simply means that the moral duty one person has to another, right? One person have to another. Although the legislation, that is laws and order, and the extensive guidance have helped to reduce the numbers of working-related accidents, the global statistics published by the International Labour Organization shows an unacceptable high numbers of injuries and fatal and financial loss due to their workplace incidents. So this simply means that over the past decades, right, we are in there, we are not safety, because safety was not well known, right? So there was lots of accident that was going on, lot of injuries, but because of this because of the Enlightenment age, people knows many things about safety. There are lots of safety sensitization that is being going on, so people now are following these rules and regulations, right? They are following these ones, and this one is helping, and it has totally reduced the accident rates, right? Then societal explosion under the moral, societal exploitation. These are standard of health and safety improve over the times. A simple requirement such as safe place of work and has a change over the years, though individual often express an abbreviated attitude to health and safety. When a serious injury or a disease is caused by work, the overall response from the society is not ambivalent, but one of the contamination, improvement in communication and understanding also have an impact, right? Then we are going to talk about social or legal. The framework of this law that has grown conduct of business and organization, right? So in these legals, in the social, we talk about legals, the laws that guide. We are talking about safe place of work. In this safe place of work, both the workplace and access to and from the workplace, right? So there should be good access place where people should work. Then safe plants environments. The employer also should provide machinery, tools, plants, equipment, and appliances used by the workers in performance of their work. Must be kept in a well maintained and safe condition, right? Safe system of work. Appropriate review, planning, and control measure should also ensure that the worker methods are safe, right? Their system should also be safe. Then train and supervision, right? The employer also should also make sure that these staffs, they should have training and supervisions, right, which ensure that the staffs are competent. Then we are going to talk about the economic, right? The cost to business.